Anytime you ask the patient to do something and the patient does it and you look at the after effects of that command, that is actually a clinical trial. It's that simple. And clinical trial has three names: interventional studies, experiment, and clinical trial or experimental studies. And clinical trials are of two types: randomized control trial and non-randomized control trial. When we have two groups, control groups and treatment group, and we assign the drug randomly, not deliberately choosing the patients of our own choice, but we assign this to the computer to decide who will take the placebo and who will take the standard treatment or who will take the medication that we have discovered in the lab. So that's called randomization. So when the randomization is done, it is known as randomized clinical trial, randomized control trial. And ideally double blinding. What does that mean? Double blinding means the patients don't know which medication they got, and the researcher also doesn't know which medication was given to which patient. You have made such a great system to avoid bias that nobody knows who got it, who got which medication. Otherwise, you could have developed some kind of unconscious, subconscious bias. So to avoid this, you don't let the patient know what medication they are getting. That's single blinding. If you don't let the patient and the researcher both don't know which medication is given to which patient, that's double blinding. And the best kind of evidence is double-blinded randomized controlled trial. That's the best form of evidence. Now, if you don't do randomization, then it is known as non-randomized controlled trial or non-randomized trial. And in non-randomized, we have another name for this: quasi-experiment, false experiment. Because you did not do randomization, there is a chance of bias. So these are the two types of clinical trials: RCTs and non-RCTs. Randomized controlled trials are RCTs, non-randomized controlled trials are NRCTs. And NRCTs, the non-randomized controlled trial, are also known as quasi-experiment. And the randomized control trial, they just are known as RCTs. And overall, the word clinical research, the clinical trial, is also known as interventional study or experimental study or experiment. So just remember this concept. This will help you understand what a clinical trial is. So let me repeat once again quickly so that you don't get confused with the information that I have given to you. This has been so much of information. I understand. I really agree with that. And that's why I want to just give a brief summary. So clinical trial is one of the study designs mentioned on the study design pyramid. It means that if you want to do research, this is one of the options you can do. And clinical research, clinical trial, they are actually the same thing most of the time: clinical research or clinical trial. And clinical trial has multiple names. What other names? Interventional studies, experimental studies, and clinical trials are of two types: randomized and non-randomized. Non-randomized are also known as quasi-experiment. And now, what do we do in a clinical trial? We give something to the patient. What is that something? It could be a medication, it could be a vaccine, it could be just simply giving a glass of water or instruction, and the patient does something and you follow up with the patient and see what is the effects of that intervention. So anytime you manipulate the environment, it is a clinical trial, or it is an interventional study, or it is an experimental study. Now, one last thing: if patients are involved, you call it a clinical trial. If patients are not involved, it is in some other field, then you just call it experimental study or experiment, or you just call that as an interventional study. But keep the name clinical trial for studies where just patients are involved. So I think that's enough of a concept about clinical trial today, and we will dig deeper into clinical trials in the next videos. Thank you. Keep learning, keep watching.